Fluconazole and Itraconazole are both antifungal medications used to treat various fungal infections, but they belong to different classes of antifungals and have some differences in their mechanisms of action, spectrum of activity, and clinical uses. Here's a comparison between the two. 1. Mechanism of action. Fluconazole. It belongs to the class of antifungals known as azoles. Fluconazole works by inhibiting the enzyme cytochrome P45014-alpha demethylase, which is essential for the synthesis of ergosterol, a key component of fungal cell membranes. Without ergosterol, the fungal cell membranes become structurally weak and leaky, leading to the death of the fungus. Itraconazole. Like fluconazole, itraconazole is also a azole antifungal. It acts by inhibiting the synthesis of ergosterol, which disrupts the integrity of the fungal cell membrane and ultimately leads to fungal cell death. 2. Spectrum of activity. Fluconazole. It has a more limited spectrum of activity and is primarily effective against Candida species, which are commonly responsible for infections like candidiasis, yeast infections, of the mouth, throat, esophagus, and genital areas. Itraconazole. It has a broader spectrum of activity and can be effective against a wider range of fungal infections. Itraconazole can be used to treat infections caused by Candida, as well as infections caused by certain molds and yeasts such as Aspergillus and Histoplasma. 3. Clinical uses. Fluconazole. It is often used for treating superficial and systemic candidiasis infections, such as vaginal yeast infections, oral thrush, esophageal candidiasis, and invasive candidiasis. It can also be used for prophylaxis in patients with weakened immune systems. Itraconazole. This medication is used to treat a broader range of fungal infections. It's commonly used for treating aspergillosis, infections caused by Aspergillus, blastomycosis, histoplasmosis, and sporotrichosis. It's also used for certain types of fungal nail infections. 4. Route of administration. Fluconazole. It is available in oral and intravenous formulations, making it suitable for both oral and systemic infections. Itraconazole. It comes in various formulations, including capsules and oral solutions. Some formulations are designed for systemic use, while others are specific for nail infections, pulse dosing. 5. Drug interactions and side effects. Both fluconazole and itraconazole can have interactions with other medications due to their effects on liver enzymes. They can also have side effects, such as gastrointestinal symptoms, liver function abnormalities, and skin reactions. The choice between them often depends on factors such as the specific fungal infection, the patient's medical history, potential drug interactions, and overall tolerability. It's important to note that the choice of antifungal medication should be determined by a healthcare professional based on the specific diagnosis and individual patient characteristics. Always follow your healthcare provider's recommendations and dosing instructions when using antifungal medications.